We're often told don't go to the emergency room unless it is an emergency, but how do you know when that is? As COVID cases continue to reach new levels, a growing number of people are driving themselves to emergency rooms for help. Christina Laurie explains why that's not just dangerous, it could be deadly.
As COVID cases continue to climb, more and more people are heading to the ER looking for testing.
I think a lot of it just has to do with the availability or lack thereof.
But if you're worried you might have the Omicron variant, doctors say the emergency room is the last place you should go, not the first. Tonight, the Wisconsin Hospital Association is joining Madison area doctors, urging everyone not to go to the ER for COVID tests.
Our ERs are extremely busy trying to take care of the people who belong in the emergency rooms.
There are several reasons doctors say this is problematic. First, and most notably, hospitals are at capacity. There are almost zero available beds, and those are for people who will die without treatment.
People who go there thinking they're having a medical emergency, like am I having a stroke? Do I think I'm having a heart attack? Right? Those types of things are where we really want our ERs to be appropriately used.
The emergency room is also your most expensive option.
Coming to an emergency department and seeing a physician, that is not free. So getting your tests through the emergency department has got to be the most expensive way you can possibly get COVID tested right now.
Testing is available at a number of SSM and UW health facilities, as well as drive-through clinics for free. And finally,
if you come to our waiting room and you sit there for a few hours and you infect someone who is really vulnerable, you may be the proximate cause to their severe illness or even to their death. You are not safe for those people to be around.
And that is why doctors are asking you to think twice before heading to your nearest hospital this winter. In Madison, Christina Laurie, News 3 Now.
If you do have COVID or having trouble breathing and are wondering whether your symptoms are bad enough to require treatment, both doctors recommend you pick up a pulse oximeter, which you can get rather inexpensively on Amazon. Small device you clip on your finger. It shows how much oxygen you're taking in. If the number drops below 88, then you should go to the emergency room for help.